A new study published in the December edition of the Journal of the American Heart Association indicates that several southern states are among the worst when it comes to heart health. Fortunately, Florida was not among them. The researchers examined whether the participants met 7 criteria for ideal cardiac health set by the American Heart Association: no high blood pressure, no high cholesterol, no diabetes, a healthy weight, no smoking, at least 150 minutes a week of moderate physical activity or 75 minutes of vigorous physical activity, and a diet with 5 or more servings of fruit and vegetables a day. Of those surveyed, West Virginians exhibited the worst heart health, meeting 2 or fewer of the 7 requirements. Those were followed by Alabama, Mississippi, Kentucky, and Louisiana. We sat down with the specialists at Lakeview Internal Medicine to get the full picture of what it means to be heart healthy.
The way that I manage patients with high cholesterol, high triglycerides, initially after drawing labs and see that they have elevated levels, I will first talk to them about diet and give them a period of lifestyle, we call it lifestyle modification, to try and get them on a low cholesterol, low fat diet. Because once you start medication, you will need to continue the diet. And having a low cholesterol diet is very important in what patients do as far as their health goes, and using cholesterol medications. The main focus of your treatment is going to be on medication, not so much diet, but you still need to continue with the low cholesterol diet, because if your body makes too much and you're eating too much, you just have a bigger problem.
We have quite a few different medications out there which we can use to decrease the level of cholesterol down in the patient. Again, the recommendations are not carved in stone. It depends on the risk factor the patient has. Then there are medications which will help to lower the bad cholesterol. Some medication work to lower the bad cholesterol plus the triglyceride. Some medications are just meant to lower the triglyceride. So the medication which we use again will depend on what kind of cholesterol problem the patient has. It's not one hat which will fit every head. Again, we have to take the patient profile into consideration, the kind of disease, the conditions they have. If it's a diabetic patient, then we literally treat them as if they already had coronary artery disease, because we know that diabetes is a major risk factor for coronary artery disease, so we have to be more aggressive. If the patient has been a smoker, yes, I will be more aggressive. The genetic ones, unfortunately, I think you have to use the medication if the numbers are really very high. There are a lot of my patients here who don't like to take medications. So for them, I tell them, go on an exercise program. A lot of them are compliant with that. So I'm happy if I can get my numbers on my patient less than 100. You're not giving them too much medication where the side effect becomes an issue. But at the same time, we are getting their numbers under control. Dietary modification, again, is very, very important.
To learn more about the importance of monitoring your cholesterol and blood pressure, and to contact the specialists at Lakeview Internal Medicine, follow the Heart Care StoryLink icon on our homepage, yourhometownhealth.com.